Hi newbies, Nurse Ruthie here, and I am loving the setting right now. The sun's going down, I'm sitting on my porch, it's like a perfect breeze. Throughout the day, the past 2 days, I usually record on Wednesdays or Thursdays. It really just depends on my vibe. I don't want to push it. It's like whenever I feel inspired, and today, right now, I feel inspired. Also, today we'll be talking about pediatrics. When I first became a nurse, I was petrified of pediatrics. I worked at the med-surg floor, so we didn't have any pediatric patients. But I remember during clinicals, I knew that I did not want to be in pediatrics. I couldn't stand to get my heart broken, those crocodile tears. So I was afraid of abuse cases. I didn't know how I was going to react. I might wanted to be very angry to the family. With anything, most of the time you fear something because you don't know about it. So right now I am in a freestanding ER. We do have all types of patients from pediatrics to adults, obviously. And depending on your facility, they may have it mixed. They may have separate areas. Also, at certain facilities, pediatrics is considered 21 and under. And that's how we are. Biggest issue that I see with pediatrics, and it's not an issue, it's a hurdle, and you learn how to overcome it, is the parents. And it's actually just gaining the trust of the parent. This is their baby, this is their love. Most parents love their children, and a lot of times some healthcare professionals may look down on parents that bring their children in for every little thing, but in their mind, they don't want to miss something. I mean, they don't want to have any kind of regrets, is what I'm imagining. Sometimes the parents will feel like shameful. They'll say, I guess I shouldn't have brought them. I guess I overdid it. And I always encourage them to always bring their children when they know their children best. I don't want them to live with any regrets. That being said, you may think that the baby looks great, but again, that parent has been around that child since it was born, and they know that child best. So listen to the parents. And just try not to criticize them. They're trying to do the best they can. Yes, you have family members show up with babies that are all balled up. They have a fever, and they have like 3 shirts and a blanket, and they didn't give them any Tylenol or Motrin. That's a good teaching moment right there. You say, make sure that, before you come in, if you have the Tylenol, Motrin, go ahead and give it to them. We believe you. We just don't want the baby to suffer. And all these blankets are kind of making it a little bit worse. We're cooking them. So sometimes when you walk into the room, or when the pediatric patient sees you, depending on their age, they just start screaming, especially when you start going for those gloves. It's like in their mind, they feel like you're going to do something terrible to them. So what I'd like to do sometimes, like when I walk in, I read the room, I see how the parents are, I look at the child. Does the child jump back when they see me? If that's the case, if they start screaming right away, what I do is I just pull up a chair and I sit down. And if they're watching TV, I'll, just chat and watch TV with them. Don't touch them, nothing. Just let them sit there and let them scream. And then they see I'm not going to do anything, right away. And that makes them feel more comfortable. That's a good time to speak to the parents and ask them, what was going on? What did they see? What did they do? The past history. It also helps if you do an examination, a mock examination on the parent, oh, I'm going to listen to mommy's heart, and then he's like, oh, can I listen to your heart? I when I do my vitals, I'll say, okay, let me see your muscles. Let me see your muscles. You look like you eat all your vegetables. And then they'll show me their muscles. I'm like, oh, this is going to measure, how strong you are. And I'll put the blood pressure cuff on. And they're very super excited most of the time. And I'm like, all right, do you like hugs? You look like you like hugs. And so then I'll say, this is going to give you a hug. All right. And so while the blood pressure cuff is going, I will hold their hand and then kind of rub it because it distracts them. Then they can feel that. This is just something I just started doing. And I feel like it makes them feel like, oh, I can still feel my hand being touched. For the thermometer, especially if it's on the forehead, I'll say, oh, let's measure how smart you are. You look so smart. And I'm like, wow, you're 98.7. They get super excited about that. And I used to use ET, but not many babies know ET, but the parents do with the pulse ox. But I say, oh, it's going to turn a light on, and they get excited about that. Sometimes, the child is screaming, you're trying to get that blood pressure, it won't work. It just keeps going on and on and on. You have to do what's best for the patient. Just document, that what you did. that you attempted to get the blood pressure, and then pass that on to the next nurse so they can try to get it as well. Have to be patient. That's the number one key, is you have to be patient and build that relationship. If you have toys on your unit, oh my goodness, that works so good. Toys, popsicles, oh, that's awesome. Kids love toys, obviously. You just have to bargain with them. The scary part about pediatrics is that they could be fine and all of a sudden, boom, they're not. Like, they get bad really quickly. If you hear your text, if you see if the parent keeps coming out like he's breathing really hard, listen to them and jump on it. Let the provider know. Do not be dismissive. Be sure to be up to date with pediatric care. There's so many different courses you can take. You can become certified with your CPN, your certified pediatric nurse, and you are going to be required to take your PALS, your pediatric advanced life support. And again, just with nursing, be a sponge. Find that one nurse who has the passion for pediatrics and just ask her all the questions, follow her, jump in on those cases. You familiarize yourself, the more comfortable you're going to feel. Be sure that you have correct holding techniques. Make sure that you have a lot of help. I do not recommend the parents' help because that can cause some trauma to the patient, I would imagine, maybe some distrust and some guilt to the parent, unless it's an emergency. You'll learn to wrap them in a burrito, basically a sheet. Are also numbing sprays you can place on the patient. There is one that is a spray, I can't recall the name of it right now, but whatever you use on the patient, try it yourself. Like, spray that spray on you, because I did it and that burns a lot. I was like, wow, no wonder the child is screaming because it's so ice cold. Nurses will say, oh, this is like Elsa's spray. Overall, just show respect to the parents, be confident, be vigilant, speak up for your patients. Excuse the gunshots in the back. I do live in the country. And in the ER setting, it's just, I've worked at this facility for about 5 years, and I see a lot of the same pediatric patients, and it's so cute, like seeing them grow up. They build a relationship with you. Oh, also, some nurses, they like to wear like a little, something cute, like a bat on their badge. Children love like Mickey and Minnie. I used to have Minnie pens, just something to distract them. And that lovely Baby Shark song. If the child is like screaming, yelling, ask one of the parents or whoever's there, do you have like a video that they like to watch? And it's hypnotizing. All of a sudden they stop screaming. They're just staring at the screen. That's a great distraction. Some facilities might have a designated like treatment room where they have distractions such as like lights in the ceilings, sounds, child life services. If you have that at your facility, use it as much as you can. They are excellent. Now, I just want to jump into something. Let's talk about child abuse. If you suspect any type of abuse with a child or an elderly person or someone who may be mentally unable to make decisions and they're not competent, you are mandated to report it. Even if you are not 100% sure, it's better to report it than not. It's actually, I believe, like a first-degree felony if you do not report it. I also think that you should report it. I would not depend on someone else who says, oh yes, I'll make the report, because you never know. Things happen. People forget things. If you are the one that has a suspicion, you should make the report. Now, let's say that you made the report, or you feel like the child cannot be discharged. You just don't, it's not a safe environment. You need to speak to your provider, and usually they will admit the patient for whatever reason. Some facilities, you may have to call the police. Also, there's been situations where the police officers will come in and they will sit in the room. If you, at your facility, I'm sure they have a protocol. If you suspect abuse, you cannot leave that child alone with the suspected abuser. There has to be some kind of monitoring. I don't know if you have cameras, but it has to be monitored. There has to be somebody in the room. If the family member decides, you know what, I don't want to stay here, I'm leaving, you call the police. In those situations, especially if you have hard evidence that they are being abused by their family members, physically, mentally, sexually. It's very heartbreaking, especially if you yourself have been through that. But you have to keep your feelings aside. As they say, you're innocent until proven guilty. It's still very heartbreaking to me. It takes a lot for me to get over. I mean, I never really get over it, but I just know that I made a change in that child's life, perhaps by making that report. And now that we're talking about it, I mean, it's not so much pediatrics, but with anyone, there are so many, especially in Florida, there's so many people that are being trafficked, and they might not even know they're being trafficked. They might be from a different country. They're here, they met somebody online, and they have all their papers, and they're like, well, you have to do this for me, you have to do that for me. You know, they may buy them all the things that they want, get their nails done, get their clothes, drive the best car, but they are pressured to do things in return. If they are of age and of sound mind, all you can do is, you know, let's say if you suspect it and there is a person in the room that you suspect is doing this, you know, you ask, oh, we're going to take her to x-ray, and then you take the person to x-ray, and then even if they don't have an x-ray ordered, and you can ask them, like, listen, I'm getting some weird vibes. Are you okay? Are they making you do anything you don't want to do? Yet again, if they're elderly, if they're handicapped, if they are under 18, you have to report it. All right, newbies, I hope you learned something. Hope you could take something back to the floor with you. Please follow me on Newbie Nurse Podcast, on Spotify, Apple Podcasts. I'm on TikTok, on Facebook. I'm on Lemon 8, something Lemon 8 now. You could just do me a favor. If you could just rate and review and share the Newbie Nurse Podcast, I would really appreciate it. I just want to keep spreading the word. And just remember, treat people how you want to be treated, because what you put into this world is what you're going to get back. Have a wonderful day. Hey, newbies, if you're liking this podcast, or even if you don't, like, share, and subscribe. See you next time. The views and opinions expressed in this program are those of the speaker and do not reflect the views or position of any entities they represent.
Oh, thank you.